Here's a shocking medical fact. The leading cause of death in the USA is chronic disease. It affects from 60 to 75% of American adults. The top two chronic diseases in this country, cancer and heart disease. All right, let's bring in Dr. Srishti Sharma from UCSF Health. Doctor, welcome. What does chronic disease mean, and how common are these in the United States?
Yeah, chronic diseases are any health conditions that you're dealing with or taking medical care for over a year. That's how it's essentially defined by the CDC. How common are they? You mentioned it is one of the most common diseases that Americans suffer from. In fact, 3 in every American adults suffer from a chronic disease, and it causes a lot of deaths too. 7 in 10 out of Americans die of a chronic disease.
Does this generally happen as we get older, or could a chronic disease be something that a young person would have?
A young person could have a chronic disease. Again, if you're living with it for a long time, I'm thinking in terms of, say, for HIV or AIDS, for instance,
okay,
that's a chronic disease that a young person could have. But typically, when we think of chronic disease, it is something that older people tend to have. In fact, over 90% of Americans over 65 years of age have at least one chronic disease.
What would be a good starting point to try to not have a chronic disease? Would it be fitness, diet? What would you recommend?
All of the above,
okay,
and more. You know, a good way to prevent chronic diseases from happening is by preventing the risk factors, and diet is a big one when we think about how do we prevent that chronic disease. There's very strong scientific evidence for Mediterranean diet or a low-salt diet. That's a good way to reduce your risk. Exercise, the American Heart Association recommends that you do at least 150 minutes of moderate intensity exercise, which sounds like a lot, but it's actually just 3 hours, a little less than 3 hours of exercise every week. Obviously, going for your prevention screening, all of that is helpful as well.
Can someone have a chronic disease and not know it?
Absolutely, and that is why chronic diseases are so dangerous, because they are silent for a very long time, which is why we also have all these prevention and screening efforts that are going on, because chronic diseases can happen when a person doesn't know. High blood pressure is a great example, right? You could have high blood pressure, and then you don't have any symptoms, but you have that high blood pressure.
So there would be initial flags, such as some blood work done. You mentioned high blood pressure. What would you tell anyone watching today to start doing that you haven't already said in order to try to help? Yeah.
Again, lifestyle modifications are a good way to prevent them from happening in the first place. But talking to your doctor, doing those preventive visits, annual visits are a great way to actually catch diseases early on, where your doctors are going to discuss risks, do your blood pressure checks, do some labs, cancer screenings. All of that happen in an annual visit, and that's a great way to screen for chronic diseases.
All right, Dr. Srishti Sharma, thank you, UCSF Health. Appreciate you coming by today.
Of course.